Hi, everybody. Welcome to Small Business Insider Live, a live stream hosted by the Small Business and Entrepreneurship Council, specifically for small business owners, entrepreneurs, and those interested in small business policy. I am Christy Arslan, and I am SBE Council's Entrepreneur in Residence. I'm also a business owner here in Alexandria, Virginia. Thanks, everybody, for joining us today. We are going to be talking about an important topic, health coverage. It's one of those, I say, top 4 issues for small businesses, along with taxes, access to capital, and regulation. Healthcare costs is the #1 concern of small businesses. And I have here today joining us 2 experts that are going to help us talk a little bit about some tools that small business owners may be able to use to help with healthcare costs. The first person joining me is Jonathan Ferguson. He is the COO of Cimplx. Jonathan is, basically Cimplx is a cutting edge business software and solutions firm that helps small businesses and large businesses with challenges, particularly around HR and benefits. And he's here to help us talk a little bit about and dissect HSAs and HRAs. Also joining us is Erica Cordova. She is the Vice President and Legal Counsel for One Digital Health and Benefits, and she has experience practicing employee benefits law and employment law. So both experts here that can assist us. How are you both doing today?
Great, thank you.
Well, thanks so much for joining us. Again, as both of you know, and many of our viewers know, Congress is yet again talking about reforming our healthcare system. A lot of conversations are going on here over the past few months about what to do. And much of the impetus about talking about continued reform has to do with premium costs, and particularly high costs faced by a lot of individuals and small businesses. Well, there are two tools in the tax code that I think small businesses really need to know about that might be able to assist them with their healthcare costs. One of which is Health Reimbursement Arrangements, which is known as HRAs, and the other is Health Savings Accounts, known as HSAs. So Erica and Jonathan, can you break down for our viewers the basics of HRAs and HSAs and how they might benefit small businesses and their workers?
Yeah, sure. Thanks, Chrissy, and thanks for having us. Well, let's frame both HRAs and HSAs with the concept of consumerism or consumer-driven healthcare. Consumerism has been a big buzzword in healthcare for years now, but in a post-Affordable Care Act world, whether it stays or it goes, and I think that's a topic we could probably have an entire webinar series on, it has never been a bigger concept or buzzword. And the idea of giving the consumer or the insured more options and control over their healthcare is one that reaches across the political divide. HSAs and HRAs are 2 popular vehicles to use to move in the direction of consumerism while attempting to better control cost. And one of the biggest differences between the 2 is ownership. So an HSA is owned by the employee and can be funded by either the employer or the employee through pre-tax contributions, and then they can use those funds for qualified reimbursements. The HRA is owned by the employer and must be fully funded by the employer. And one of the biggest advantages to an HRA is that funds can also be used for non-fixed indemnity plans. So plans such as your health insurance, your dental insurance, or even vision care, those premiums can now be funded with those dollars. And that provides a lot of flexibility for small business. But I'm sure Erica has a lot more details she can go into.
Erica?
Yes, sometimes these can be complex arrangements, but they're definitely valuable arrangements. So when we look at the health reimbursement arrangement, as Jonathan mentioned, these are funded entirely by the employer, and the employer typically cannot input a limit on how much they put into this HRA unless they integrate it with a group health plan. And we'll talk a little bit later, maybe I'll get into standalone HRAs and integrated HRAs and what goes on there. But the HRAs are really helpful because you can use those pre-tax dollars to pay for your qualified medical expenses and other things like Jonathan mentioned. With the health savings account, these are very similar to the HRAs, except they differ in that the employer can contribute to it and the employee can contribute to it. But there's a few more requirements you have to meet to use an HSA. So first, the employee would have to be enrolled in a high deductible health plan.
Mm-hmm.
And if they do use an HSA, there's certain limits on how much they can contribute per year. But again, like the other plans, these can be used for qualified health expenses, and the funds in your HSA can be rolled over from year to year, and it can kind of work like a retirement plan for the individual as well, because after the age of 65, they can even use it for non-qualified medical expenses. So that can be really valuable when compared to something like a flexible spending account where you forfeit those funds every year at the end of the year.
Now, with an HRA, one of the attractive features of health reimbursement arrangements that differ from an HSA, and of course you are the expert, so please clarify if I'm getting this incorrect, but you don't necessarily have to offer or have a health insurance plan attached to it. And as you know, many small business owners are unable to afford group coverage for their workers, but want to offer some sort of way to assist with healthcare costs. So is that correct that with an HRA, if you set up one, you don't necessarily have to offer group health coverage to your workers?
Right, so this is kind of a timeline issue. So the way things used to work pre-ACA, you could set up a health reimbursement arrangement. You didn't have to offer it along with a group health plan. You could fund whatever you wanted into it and reimburse medical expenses. But then after the ACA was passed, there was a component of it that basically said you have to comply with those rules, like not having annual and lifetime limits, which of course most employers don't want to have an unlimited amount of money that they're spending in their HRA. So that made it difficult for an HRA to stand alone. So what the ACA said instead is that you have to integrate it with a group health plan, which means you offer it alongside a primary group health plan. But then most recently, at the end of 2016, we got the 21st Century Cures Act, which kind of gave smaller employers a reprieve to that. The 21st Century Cures Act essentially says that if you're not an applicable large employer under the ACA, so you have less than 50 full-time employees, and you're not a part of a control group of other companies that together have 50 or more employees, then you can have one of those standalone HRAs and maybe put money in it so people can pay for their individual premiums. There's also a few other ways that you can work out a standalone HRA. You can have one to reimburse spousal healthcare expenses, retirement healthcare expenses, and in some cases, Medicare reimbursement if you're a small employer under 20 employees.
And then also with the HRAs, you mentioned, like, with an HSA, it's money that the employer or the employer are able to contribute, but that is money that they have to contribute prior to the healthcare expenses, essentially money they have to put aside. Whereas with HRAs, it's a reimbursement. So if I'm correct, the employee would go out and have a approved healthcare expense, whether it be they want to use it for their insurance premiums or to pay for a doctor visit, and then essentially they bring back that receipt of what they paid and the employer reimburses them. So it's not money that they have to put aside essentially, but essentially money that they reimburse, like a business expense. Is that correct?
That's correct.
Okay.
And that's what makes the HRAs particularly attractive compared to the HSAs, where either the employer and the employee is funding it, and there's caps on how much money goes into it.
Mm-hmm. So how complicated is it for a small business owner? As you know, many small business owners don't have the luxury of experts like you working on their behalf, or a team of, accountants or HR specialists in their business to help them set up something like HSAs or HRAs and manage those. How do they compare in terms of ease of use and ease of setup?
Mm-hmm. So sometimes it can be complicated depending on what you're trying to accomplish, but thankfully there's a lot of vendors out there in the space that can help you with that. So to lay out the basic challenges with HRAs versus HSAs. On the HSA side, I mentioned that you have to be enrolled in a high deductible health plan, and you can't have any other non-high deductible health plan coverage. So you can't have a PPO health plan, or that employee can't have a health FSA. And as an employer, a lot of times you don't have control over what the employee is enrolling in outside of your company. And if you don't offer benefits at all, you don't know what they're enrolling in. But a lot of times they'll come back to you slightly disgruntled saying, well, why didn't you tell me I couldn't have these other things? So it's important to know what can and cannot go along with an HSA. And that's anything basically that's not a high deductible health plan. On the HRA side, it goes back to that plan design issue again. Whether or not you have to integrate it with your group health plan, or whether you fit into one of those exceptions where you can have a standalone HRA, like the one for qualified small employers that came out under the Cures Act in 2016, or the spousal, Medicare, or retirement HRAs.
Jonathan, you're in the business of, helping businesses, set up things like this and help with their health benefits. What is your perspective on ease of use and setup particularly for smaller businesses? So let's talk about those that are under that 50 threshold.
Yeah, well, I think it's important to look at some facts and figures. In 2013, 11% of workers in small businesses, which is defined as under 200 lives, enrolled in an HSA high deductible health plan. And by 2016, that number increased to 19%. So that's significant growth over a short period. And studies show that trend will continue. Now, some of that may be a byproduct that, the years of low deductible health plans may be by the wayside and more plans fit into that mold. But in that same period of time, HRAs didn't grow at all. They were at 9% in 2013 and they were at 9% in 2016. And I think that there is significant room for growth. And with the recent passing of new laws like the 21st Century Cures Act, I think the utilization of HRAs by small businesses will be among the fastest growing segments. But education is really key. So, having those trusted advisors and finding those trusted advisors is going to be very critical for business owners. Because if somebody doesn't know that a great tool exists, how are they going to take advantage of it? Mm-hmm. But it's also key for smaller employers to understand why they want to look at these programs in the first place. And why not just say, it sounds like a lot of trouble. Maybe it's not worth it. Studies have shown for a long time that attracting and retaining good talent is predicated around a benefits package. In fact, AFLAC puts out a workforces report, and their studies show that 58% of employees say that they would be willing to take slightly less pay for a job that had a better, more robust benefits package than what they're saying offered. And yet also the leading concern for employers under 50 is controlling costs. So the HRA is a great way to accomplish both, and it just makes good business sense.
And don't both HRAs and HSAs have some tax benefits for employers? Are they able to deduct the costs or the contributions from their taxes?
Yes, they are.
Great. So, as a small business owner, again, for me, like the biggest challenges we faced, I've had the benefit of utilizing a plan with an HSA. I found it very easy to use to set up the HSA and didn't really have an issue in terms of that process. That process was easy to use. What's the process for an HRA? So if a business owner would like to set up an HRA, is it a complicated compliance process to set up an HRA plan?
Generally, it's really not that complicated. All you really need to have is a plan document. So this is a document that's required under Section 105H of the IRS code. And all this document does is say, now you can have a health reimbursement arrangement. So you get this piece of paper in place, and then at that point, you have the opportunity to reimburse medical expenses for your employees.
Are there any cons or to each of these plans, or anything that business owners should be aware of with HSAs and HRAs?
Well, I think they're yes and no. I think both the HSA and the HRA have pros and they have cons. One of the pros for the HRA, especially from a business owner's perspective, is that when they fund that money, the money remaining in that account that's unused is theirs. And so if an employee were to leave, the business owner is going to retain those funds. Where if the business owner were funding an HSA, they have paid that money out. If that employee leaves, they can take that plan. Now, it kind of reverses when talking about the respect to the health plan, because with the HSA, a lot of times that high deductible health plan is going to be potentially group coverage at the employer. So there is no portability for that employee to take that plan. But whereas that HRA, if they are reimbursing that employee for going out to the open marketplace and finding their own plan, one that fits their family needs the best. That's their plan. And if they were to go somewhere else, they can take the health coverage, but then those HSA or HRA contributions are going to stay with the employer if they were to leave.
Got it. Got it. And with both, the employer gets to decide how much they're able to put aside. So is that correct? Like for an HSA, the employer, based on their financial situation, can decide how much they want to contribute to the employee's HSA. And then similarly with HRA, they get to decide the reimbursement amount or how much they will reimburse in healthcare costs. Is that correct?
That's correct. They can determine how much they're going to contribute as long as they don't do that in a discriminatory manner. So as long as you're not cherry picking employees that you want to exclude or give more money, typically that's going to be okay. Even under the HSA rules, you actually can make distinctions in the amount of money you give different employees if you fund the HSA through your cafeteria plan. So you do that on a pre-tax basis. So as long as you're not doing it on a protected class, something like race, age, disability, you're usually pretty good to go there.
And what about the business owner? Obviously, you know, a business owner themselves, and many small businesses are pass-through entities. They're either LLCs or, you know, sole proprietors or, you know, partnerships. And so, you know, the owner would want to have some sort of health benefit. With these two types of accounts, is there any impact on the owner's ability to participate?
Sometimes there can be. It depends on the structure of the business. So for some of these accounts, 2% shareholders in an S Corp can't participate. So that's something to keep in mind. And that will depend on a case-by-case analysis of your company, how you're structured, and what other type of people you have in the company.
Good to know. I know one of the areas that SB Council is working on is to try and expand health reimbursement arrangements to allow the owner to be able to get the same benefit with the non-discriminatory rules in place. It would provide a level of protection that whatever the owner sets aside for its workers and it would be available for themselves, and they couldn't set aside more for themselves and not their workers. So we're looking to try and work with Congress to expand health reimbursement arrangements so that owner can get some benefit, because we think if the owner is able to get some benefit, it would expand the number of small businesses out there that use HRAs, helping many workers and small businesses get some of their healthcare costs reimbursed. So that's one of the areas which we are working on. So let's talk a little bit about policy, because we, as mentioned earlier, Congress is looking to repeal and replace the Affordable Care Act. There's also, as mentioned, efforts to improve and expand HRAs and HSAs. What should business owners, or what proposed changes should business owners be keeping an eye out for?
Yeah, well, first and foremost, the Affordable Care Act is still the law of the land, and compliance should still be taken very seriously as it relates to the ACA. The continual chatter about repeal and replace in the media has caused a lot of confusion in the market. I think that folks may take their eye off the ball in terms of their requirements, and we don't know. You know, obviously there was a narrow passage in the House of the AHCA. The Senate is a whole different animal, and so I think it's important to break those apart. One of the big changes, as we've already talked about with regard to the regulatory environment, is what happened in December 2016 with the passage of the 21st Century Cures Act. And I think it's really important to understand the political climate behind that. You know, that was signed into law by President Obama. The bill passed the House 392 to 26, and it passed the Senate 94 to 5. So unlike the ACA, it's a law that truly has bipartisan support. So when we look at things that are a part of that law, like Title 18, which is the reimbursements for HRAs to the smaller employers, the non-ALEs, you know, before the passage of that law, they could face up to an excise tax of up to $100 per employee per day for reimbursing healthcare under Section 4980D of the Internal Revenue Code. So, you know, that was something that I know a lot of small businesses did to try to help their employees out. And all of a sudden, it was the largest penalty that somebody could face with regard to that. So that was a big regulatory change that came out of Washington that helped small business.
And is there any other changes that, with repeal and replace, anything that business owners should keep an eye out for, whether it be in terms of planning? Like, should they be planning, or is it just, a wait and see? Should they just continue to operate the way they've been operating under the ACA, or are there things they can do to plan ahead in terms of just dealing with health coverage costs?
So for now, I would recommend that you stay the course. We still have a little ways to go before we see if this passes the Senate. It has to go back to the House at that point. Everyone pretty much has to agree on it before it can get to the president's desk. But in the interim, something that is worth keeping an eye on that's inside the HCA are some changes that they're suggesting around HSAs. So at one point they had this proposal where, and instead of having this employer mandate that we have now, employers would have the option to not have to offer coverage, and then the government would put a certain amount of money in employees' HSAs. Now that's fallen by the wayside now, but there's some speculation that that may come back into the bill once it goes to the Senate. So we'll have to keep an eye on that. Another thing that they're looking at is maybe widening what qualified medical expenses are. Again, so you may recall before the ACA, you could do over-the-counter expenses through your FSA and things like that, but then they cut that off under the ACA. So they're looking at possibly expanding that definition again to include over-the-counter medicines again.
And is there anything, obviously, again, as mentioned, healthcare costs, it's one of the things that small business owners are always very concerned about. For many business owners, their employees are like their family, critical part of their business. Any recommendations you can have in terms of, tools that they can use to help address the cost issue? And then also, particularly you, Jonathan, around compliance. Any tips you can give small business owners on how to keep up to date with what they need to know to comply with, laws similar to ACA?
Well, I think the first thing is having a team of trusted advisors. And I think that sometimes small business owners, and I've been one myself and currently am one, I think that sometimes you don't feel like there's all the tools that are out there available to you. And it's a matter of just finding the right folks to talk to. I think there is a comprehensive view that needs to be applied to employee benefits. And obviously there's a lot of compliance regulations around that, but we've talked about some great tools today. I think that the health markets aren't always as scary as sometimes they're made to be. I also think that there's a lot of great options out there, such as voluntary benefits. I spent 10 years in voluntary benefits, and so I see a tremendous value there. But it's really having a comprehensive strategy, sitting down with somebody that's going to be able to advise you on making the right decisions, and then stay with you, that as questions arise, be able to answer those questions, but also inform you of regulatory changes that come about.
Great. Anything from you, Erica? Any tips you want to share?
I would just say keep in mind what we've talked about all along here, which are the HSAs and the HRAs. So we've talked about how costs with healthcare continue to rise. And a lot of times we see that in small businesses, people gravitate towards high deductible health plans because they tend to have lower premiums. But of course, a high deductible health plan has a high deductible. That's just kind of inherent in it. So one thing that you can do to kind of help your employees counter the cost associated with that, the out-of-pocket expenses, are talk to them about these HSAs and these HRAs and how they can use those pre-tax dollars to help them fill in the gap between their deductible and what they have to pay until they need that deductible.
Well, great information from you both, and thank you so much. Jonathan, did you want to share Cimplx's website and a little bit about the company for anybody who wants to check out your benefits and services?
Sure, I'd be happy to. Well, the name Cimplx comes from the transformation of the word complex into simple, which is sort of our guiding principle as we work with our clients to help them take complex business and regulatory challenges and make them simple through technology and also customer service. So we're more than just a technology firm. Our folks have dedicated account support that they can talk to at any given time. In late 2014, we launched our Affordable Care Act compliance software, which has been immensely popular and is widely used by companies large and small all across the United States. When I say small, I'm talking typically 50 and above. But we continue to offer the best-in-class ACA solutions for compliance and reporting, but we also are just this year launching a administration arm that's going to offer an array of services, some of which we talked about today, things like the administration of flexible spending accounts, health savings accounts, health reimbursement arrangements, and other benefit planning services. So we're really well positioned to help small businesses, kind of navigate those waters of the regulatory complexity.
Great. And the website?
Our website is Cimplx ACA. We're going to be launching a more robust site that's going to offer some of those other services as well. But we welcome folks to come check us out and also submit a request for information. We'd love to have conversations with folks.
Well, thank you, Jonathan and Erica, for your time and your expertise today. For all of our viewers, if you'd like to learn some more information about the Small Business Entrepreneurship Council as well, we are a nonprofit professional organization for small businesses. Our goal is to champion you and the issues that matter to you on Capitol Hill, to create an economic climate that allows you to start and grow your business the way you need to be successful. You can find us at sbecouncil.org. You can also follow us on Facebook and Twitter at SB Council. We host Small Business Insider Live every Thursday at 1:30, talking about the issues that matter to you and your business. So hope you can join us next week. And thank you again to Cimplx, to Erica and Jonathan. We really appreciate your time.
Thanks, Christine.
Have a great week.